that they can have the opportunity, certainly if they are symptomatic, to get tested themselves, but even if they're not symptomatic, to undergo that 14-day period of isolation. So as we ramp up testing and contact tracing, we will also be hiring. We're going to move from 70 team members conducting contact tracing to at least 250 contact tracers. And we're going to expand beyond that, as I mentioned the other day. Looking at the model that we sort of borrowed from Massachusetts, we think we may have to get up to 700, but what I want to assure people is we will get to as many contact tracers as we need in order to do the work that is so essential. In order to make this happen, this week we signed contracts with Salesforce and Accenture. These companies were selected because of their experience rapidly standing up a contact tracing solution in Massachusetts. Their use of technology will allow us to manage the task of calling thousands of contacts every day from call center agents here in Louisiana. The system will be set up and ready to support contact tracing by May the 15th. Now, I don't want you to think that we haven't been doing contact tracing all along, because we have, but we're going to greatly increase our capacity to do that. These call centers are Louisiana companies employing 100% Louisiana agents or callers. 250 team members will begin training next week, and the training is being managed and coordinated by the LSU Stevenson Disaster Management Institute, which actually specializes in call center operations. We're also working with the Louisiana Workforce Commission and other statewide partners, helping to connect Louisianans with jobs. It is incredibly important to me that Louisianans are part of this vital solution to fight the spread of COVID-19 in the state of Louisiana. To be a contact tracer, you have to be a high school graduate. You have to feel comfortable having a telephone conversation with someone and entering data. Obviously, you have to be compassionate and able to protect and honor patient privacy. And you have to complete a very detailed training session. But if you're out there and you think you fit the bill, you can apply by email at contacttracing@la.gov. Contacttracing@la.gov. So this is going to be critically important going forward. I will tell you that as we have continued to have the mitigation measures in place, ramp up our testing and so forth, we're in a different and a better place than we were 2 weeks ago, and we're in a far different and much, much better place than we were 5, 6, 7 weeks ago. We are targeting an increase in testing of 100,000 tests per month to get to 200,000 tests by the end of May. Within the month of May, we want to have 200,000 tests conducted. And obviously, we need to do that where it's most important to test, not in the places where it's easiest to test. And so this requires that blueprint where you have to figure out exactly where those places are that you need to be testing, and then put in place all of the planning and the resourcing necessary to get it done, both in facilities and with mobile labs that are going into communities, especially those communities that have a higher positivity than others and perhaps lack transportation. And so they're not getting out and going to the nearest testing center as often as we would like. So at this point, I'm going to ask Dr. Billioux to come up, and he is going to talk more about contact tracing. I think he's got a couple of slides for you. And following that, I will come back up here and we will start to take your questions.
Thank you, sir. Happy to have the opportunity to talk about this topic because it's one, as the governor noted, we've talked about for some time. But contact tracing and testing are really critical. They've been critical previously, especially testing and how we've managed the virus. But contact tracing is really going to be critical in how, as we move to phases down the road, are going to allow us to prevent the spread of this virus. So contact tracing is really the process by which we identify all the individuals who might be at risk of developing COVID-19 through exposure to somebody who has been diagnosed with the viral infection. Based on CDC guidelines, people who'd be considered a close contact include household members, people who are intimate partners, individuals who provided care to an individual, either in the household or to that individual with COVID-19, and anyone who's been in close contact with a case. And we define close contact for the reasons of contact tracing to say you've been within 6 feet of an individual for greater than 15 minutes. And so it's really important for us to identify those groups of folks because they're, again, at increased risk for developing COVID-19. In the beginning, in the first days of the epidemic, we have and continue to have a team in the Office of Public Health conducting contact tracing. Early on, every case that was notified to us, we were going through and doing comprehensive interviews with those individuals, finding out about their close contacts, contacting their close contacts, and then continuing to spread the ring that way. But pretty rapidly, we had, again, in the first 13 days, the fastest growth in COVID-19 in the world. And that outclassed our ability to do that comprehensive contact tracing with each individual as the epidemic spread. And so that team has been concentrated since that time on identifying, doing contact tracing in areas where there's not as much viral spread or where a virus is new in that community, or for those high-risk clusters, especially nursing homes that we've spent a fair bit of time talking about, so that where there's a real need to dig in and help not only understand what's going on in that setting with the spread of the virus, but make sure that the proper measures are being taken to contain the virus within those settings. But now, as we move into looking at the next phases and considering relaxation of the stay-at-home order, it's more critical than ever that we have the ability to comprehensively interview every case that's detected and identify the people who could have come into contact with those individuals so that we can give them the information, most critically about quarantining and isolating if they have symptoms. In other words, limiting their exposure to the public. This will allow us to identify people who really shouldn't be out there going to shops and to facilities and reduce the risk of spread, even as we, in general, move to being able to go to a little bit more of the kinds of activities that we had been doing before stay at home. So it's really critical, and that's the reason that the department, as the governor noted, has been working so hard on identifying the right measures that we can take to surge our ability to do contact tracing, and most importantly, to do that in a way that protects patient privacy and that also supports Louisiana. And as you heard from the governor, we're really looking at Louisiana-based solutions. So contact tracing is going to be that way that we're going to quickly identify where we may also see an increase in communities, where we're seeing hotspots develop, and then again allow us to get control over those hotspots without having to necessarily, reduce overall movement. So what happens when somebody reaches out to you and says, listen, you might have been exposed? So a couple of things, first of all. One is are the individuals that are reaching out doing the informational interviews are going to be thoroughly trained. Our team currently is thoroughly trained to do that in a compassionate way, but also to do this informational interview in a way that protects your privacy. As you will likely be asked questions about who you might have come into contact 48 hours before you began to have symptoms or were tested, and certainly subsequent to your testing, that period of time between then and your ability to isolate. Our hope is that most people are largely staying at home, and people have heard certainly that if you're sick, you should stay at home. So that latter period, you're probably not coming into a lot of contact. But for the period before you were symptomatic or before you were tested, we want to know what was going on and who you might have come into contact with. But I want the public to be assured that information is held in privacy. And as we then reach out to contact those individuals and ask them to isolate, we're not revealing that person's name. We're not revealing any details of the individual that they came into contact with. Instead, you would get a call and inform you, you may have been exposed per our records to COVID-19. They're going to ask you questions about your movements, about your ability to isolate. And then they're going to advise anybody who's been exposed to please adhere to our quarantine. And that means isolating if you have symptoms or quarantining if you don't, and staying at home for the duration of 14 days or longer if you're symptomatic and ill. And I just want to make that point clear that, one, this is not something that is going to risk sharing of individual information broadly, but two, there is a duty inherent in all of this and an ask really of the public that if you are contacted by the contact tracers, we really need people to take that seriously and adhere to staying at home, because we will not be able to contain the spread of the virus and be able to have people reopening parts of the economy if we don't adhere to quarantining and staying at home when we're asked. And so I think this is another opportunity, a more specific subgroup opportunity for us to do our duty to our citizens and to help each other as we're trying to slow the spread of the virus. I do want to talk a little bit about testing, because testing is really that important first step that leads into contact tracing. We can't do contact tracing or case interviews if we don't know who's infected in the first place. And as you heard the governor say, we've been able to do a significant amount of testing over time, but we are also increasing our ability to test and doing that especially to reach specific communities. We've invested over $500,000 in equipment and over $3 million in supply as a state just to augment the capacity at our state lab. And if you remember the early days of the epidemic, most testing was going on in the state lab. And we continue to see the state lab as a key asset, especially in serving populations like our nursing homes and our prisons. And so we've made significant investments in expanding the capacity of that lab more than 5 times where it was previously. But we've not stopped there. We think our role is also to coordinate and advocate for the larger lab community. And so we've had a collaborative that I think you've heard me reference before, working with laboratories across the state, where we are also asking them about their needs. We're coordinating our testing efforts so that we're sure that as we're getting supplies or as we're seeing populations that need to be tested, we are able to coordinate around those. And as we've been advocating with our state, local, and federal partners, we've been able to share a unified message of what Louisiana needs. And you've heard us talk about needing to go to 200,000 tests. And that's because we're ramping up all of our testing in coordination. What I want to point your attention to with this graph is where we are up to this point and show you the tremendous increase that we've had in total tests performed week by week, starting in March 8th, and then this is going through April 30th, through the end of April. But what you can see is that the weekly testing numbers have significantly increased in blue, those total bars. The orange bars are the positive tests out of those. And so another heartening trend that we're seeing is that as we're expanding the overall tests, we are seeing that the percent positive, the amount of that orange bar compared to the blue bar, is coming down a little bit too. And that means that we really are getting out ahead and making good headway. This last week, actually, that's not shown up there, I think 39,000 tests completed. And so we're continuing week on week to improve. And then the next slide, I'll show you what our goals are for the month of May. I want to make clear, though, this is assuming the underlying steady state of about 100,000 tests. This is a graph depicting what above that weekly average that I was showing you before are we trying to do now in the weeks to come. So you can imagine adding, that 30-something thousand, or on average 25,000 a week, to these numbers. And what you see is week by week, we want to get up to a point where we would be testing statewide enough people to have reached 200,000 tests by the end of May. We want to continue that in June. As we test, we're going to learn where we need to be, looking at percent positivity, meaning how many of those tests are coming back positive, but also percent coverage, making sure that rural parishes and parishes with particularly vulnerable communities, particularly vulnerable individuals like people who are nursing home residents are being reached as well as we continue to surge. And we're going to do that through a number of different ways. One of them I talked about is our organization and coordination and advocacy as a group of labs across the state. Another is through the partnership with the federal government. We know that the federal government has made the commitment to supply us with 200,000 swabs, supply the state lab with reagents across the months of May and June. And we are distributing those swabs both to partners that are going to be using the state lab, but also other lab partners across the state who are able to marry those swabs to viral transport medium and test through mobile testing sites as well as community testing sites that are walk-up. I'll note that we also are working with labs that are innovating, printing their own 3D swabs, and I know the governor's talked about that before, producing their own viral transport medium so that we're not simply relying on the federal government's kind 200,000 swabs. We want to also make sure that we have the ability to be more self-sufficient, as well as to surge more testing if needed. And we're also looking at non-swab-based forms of testing. You might have heard of saliva-based testing. Our own state lab is currently evaluating and validating a method for doing saliva-based testing in our own state lab. And so in that way, we think that we will be able to add another 100,000 tests over what we had done in the month of April, and go to where we need to go to be able to test. Because again, that's critically the first step that's going to lead us to the contact tracing and our ability to reach out to all of you and isolate for people who have been exposed or who have the virus, and allow the rest of society to begin to go back to more daily activities that you've been used to previously. So thank you for your time.
So Dr. Billioux is going to come back and answer your questions here in just a second. I just want to make a point that if we did 300,000 tests per month, and if we had 2,000 contact tracers, that's not going to be enough for us to keep a lid on the cases. It is critically important that we do that in terms of increasing our testing and our contact tracing. But we all have a role to play going forward when the restrictions begin to ease and people travel more and more businesses open and more employees go back to work and more customers go in and out of restaurants and retail stores and personal service shops and those sorts of things, there will be more contact. And so we have to do our part in that. And first of all, you're still going to be safer at home. If you are vulnerable, you're going to need to make sure that you exercise more caution than someone who is not. So if you're 65 or older, if you have one of these chronic health conditions that predispose you to poorer outcomes should you contract the disease, hypertension, diabetes, kidney disease, heart disease, obesity, you really need to be extremely careful. And if you live with someone who is more vulnerable, you need to be more careful as well. But it's incumbent upon all of us to do the things that are going to be required. For example, wearing the mask, staying 6 feet away from people who are not part of your household, making sure that you're washing your hands, and all of those things become incredibly important. And if we do all of those, we will be successful, meaning that we can re-engage more of our economy and get people back to work and so forth, without seeing cases spike to a point that we can't keep them under control. But I don't want people thinking that if we get the testing where we need it to be and the contact tracing where we think we need it to be, that means that everybody else can go back to doing whatever it is that they were doing before this pandemic started. That's just not the way this is going to work. Not here in Louisiana, not anywhere else in the country. There is a new normal, and so we do want to prepare people for that. And that's the purpose of this presentation today, that really took the deep dive into contact tracing and testing. So with that, I'm going to ask for questions. And I suspect most of your questions are going to go to Dr. Billioux, given today's subject matter. So I'm going to go ahead and yield the podium to him. Ask your questions of him as best you can. And then when you're finished with Dr. Billioux, I will come back. Thank you.
Sam.
So to clarify, we're getting up to 250 contact tracers through these new contracts that will be available by May 15. Are we still aiming to get to 700? And can you also talk about how we arrived at the number 700?
Sure. So as the governor said, we're going to get as many contact tracers as we need based on really what we find when we start reaching out to folks. Previously we had the number 700, and it was really based at looking at, again, the Massachusetts model. They're about a week or two ahead of us, looking at how many they needed. Their population's about double, and they initially were looking at 1,400 contact tracers. So we want to give ourselves a concrete goal. I'll say, though, the role of that contact tracer, again, is not only to spend time talking to an individual and finding out about how they're doing and their symptoms, but identifying those contacts and then reaching out to those next contacts. Right now, because people are adhering to the stay-at-home order, the number of those contacts is less, is fewer. So We think that early on, you're not going to have quite as many phone calls that are going to be made. However, when we're at the point where people are moving about more freely, contacts increase, we're going to be watching those numbers. We have a goal of reaching everybody who's been diagnosed within 24 hours of their diagnosis, and then reaching the majority of the contacts within 24 hours of us being alerted to their contacts. And as we watch our ability to do that, we'll hire more individuals. I think we've got great resources in the state. You heard about the 2 call centers that we are currently contracted with, and we have others that we can contract with in the state that can help us move up to larger numbers if we need them. Because what it comes down to is we're going to need as many as we need. And as we move into doing this comprehensive contact tracing, we'll adjust as we need to. Yes, please.
How does LDH or these contact tracers, how are they going to go about getting the contact information for everybody they speak to? And then off of that, say you reach out to somebody and they're not forthcoming or helpful. I mean, is that a situation where you say thanks for your time and have to move on? I mean, how do you get the information if people aren't forthcoming in some aspects?
Sure. So for your first question, if you have contact details on the individual that you've come in contact with, our team will ask for that information. Again, it's kept in a private system. We're using the same kind of level of security that hospitals use for your healthcare information. But if you have that information, we're going to ask for that because it makes it easier for us to reach that person. If not, we'll work with either a name or a location and work with maybe the business owners or whoever to try to identify, if we can identify who is there. And again, I know that for some people that sounds scary. People are tracking my movements. The goal here, though, is to help protect you. The goal here is to identify, were you at risk? And I would certainly want to know that somebody reaches out to me if I had been exposed and at risk. Also so that I can do my duty in removing myself from public and reducing the spread. The faster that we get a hold of that, the faster that we control the virus and continue to move through phases and control this spread. But so all of that means the people that we're hiring, as you heard the governor said, really have to have compassion and good training. Because as they're getting that information from you, we need to make sure that they're doing that in a very sensitive way, that they understand some of the medical concepts that we're working around, and also that somebody who may be reluctant or skeptical, they're able to work with that individual, give them the assurances that I just gave you, and hopefully lead to a situation where that person's going to be more forthcoming. But I think it's a fair point. This system works on the basis that we want it to work. We all have a duty and an opportunity to help when somebody reaches out to us, whether we're a case or whether we're a contact. And if people don't participate, if people don't cooperate, it's going to be very challenging to be successful. So we really do want to encourage people, understand your privacy is protected, but we need your participation, not just in the interview, but then in the staying at home, universally after that. Please.
Is there a set list of questions that the contact tracers will ask people who have been diagnosed about how many questions, how long will the interview take?
Yeah, so there is. There's sort of a free-flowing script. Certainly the earlier parts are a little bit more scripted out, but part of the training that we referenced that they're going to get is really how to sort of react to different prompts or needing to work more on getting somebody to be more open, or where you find out about maybe a concerning exposure, digging a little bit deeper. So it's going to change and depend. But I think that the goal with these conversations is really to keep them relatively short. I think they can probably span 10 to 20 minutes on average. Again, it depends on the number of contacts and sort of how in-depth that interview needs to be. Leo.
Most people I know don't answer phone numbers that they don't recognize because they're afraid it's a telemarketer. What's your workaround on that? And is there a notation that comes up on the phone that it is a contact tracer?
Yeah, and so I think that's a great question. I think right now I don't believe there's going to be anything that says you're a contact tracer on the phone when we dial. But this is something we're going to have to track and see if we're having low numbers of people answering our phone numbers. I'll also say the system, the platform that you heard about, Salesforce, as being installed by Accenture, is also one that we chose because it was very adaptable. And we're also looking at other technologies to potentially layer on top of this, reaching out through SMS, through text messages, potentially reaching out through apps in the future, other ways for us to reach you. But all of this is a plan that then is going to have to be informed by data as we start launching, and then potentially adapting depending on where we're seeing challenges.
You've talked about the federal government promising 200,000 or resources, 200,000 tests a month. Where are we at with that? How many have we received? And can you explain a little bit more how you guys are deciding where to allocate those testing resources?
Sure. So if you break it down, that means that we should be expecting to see 50,000 swabs and transport media, 50,000 swabs a week. We're going to have to make up about 50,000 of the viral transport media to get to the full 200,000. But that's what they've committed to. This week they initially started with a portion of the swabs on Monday, and then I believe yesterday we received I want to say the remainder of that 50,000. I don't have those numbers off the top of my head, but I think that for week one we've had those delivered, and then I think as the federal government was getting their process ramped up, I think that it'll be a little bit more set going forward. How we distribute those is through both the partnerships that we have with existing labs, because we want to make sure that our existing labs that we're counting on continue to be able to reach out. We have, through GOSEP, multiple mobile testing sites across the state and community testing sites across the state, so some of the swabs go to them. And then we've been working on this plan with our regional medical directors and local partners. So these are public health leaders in the community who then themselves work with the health entities in the community, and in particular settings like nursing homes, local parish prisons and the like, and understand the need that's informed by epidemiologic data. So we are identifying hotspots, and then they're able to prioritize how they reach those settings. Both directly, we have assembled teams at the local level that themselves can go out and test, as well as with partners, university partners, other healthcare partners that can take those swabs, go out and test, and then have them run at labs. So it's really it's a statewide process that has to be pretty highly coordinated. Fortunately for us, it doesn't have to all be done by the state directly. There are specific priorities like nursing home hotspots that we will be doing ourselves.
How
Please.
retroactive is the testing? Is there a cutoff date where, you got diagnosed 6 days ago, you don't get reached out to by a contact tracer? How many cases are we looking at that exist right now who will be followed up with?
So right now, our team is already doing contact tracing. Again, we have about 70 to 75 individuals who are doing that, focusing on areas where, again, there's maybe not been as much testing, the virus isn't felt to be as widespread, or there's a cluster. So some people are already being contacted in that way. Our goal would be, to, by the end of next week, begin in earnest doing the contact tracing at volume. We're going to have to learn how much we're able to accomplish with that first group of 250. I think we're fortunate to be working with a partner like Stevenson Disaster Management Institute that's able to help us with bringing in this workforce, training people up quickly. We think getting the next numbers after that online are relatively fast things, and especially if lots of people email contact tracing at la.org with an interest in contact tracing at la.gov. And show that they have an interest in this, we can really scale up those capacities quickly. So what I would say is, we're going to have to see how many we're able to reach initially, and then again continue to scale as needed.
Is this as far as these workers in the call center go, is this a 24-hour job? And then as far as contacting people, or is it just normal hours being able to call people? And then what is the pay for these?
So I don't know the answer to the second question. Again, we are contracting with call centers, and they're going to be managing their staff. What I will say, though, for the first question is, I think it's going to be largely during business hours. Don't expect us to be calling you in the middle of the night, because again, nobody's going to want to answer that interview question at that point. And presumably, in the middle of the night, you're not out making more contacts. We have time to reach you the following day. Leo.
One question about the contact tracing. Is there a business element to this? Is there a business side where the businesses themselves will have to contact trace and keep up with customers?
So currently, we're not asking businesses to keep a log. We certainly will be reaching out to some of those settings. Again, if there's a potential exposure that we think we do need to reach out to that organization and find out about how many people might have been there. Do you have a sense of how we can reach out to them? I would imagine we would do that kind of work, and we do that for any outbreak investigation in Louisiana. But we're not currently contemplating asking for that kind of a log. Other places, are doing that. And again, as I said, we're hoping to learn as we deploy the system. If we're able to do this without having to ask for that kind of information, then that would be great. If we need to adapt our response over time, we'll also look at that.